Today, I wanted to talk to you about blood thinners. This is a medication a lot of people are on, and I counsel about it almost every day, so I thought it would be great to speak with all of you about it. The three most common blood thinners include Eliquis, Xarelto, and Coumadin. The first question I always get asked is, why am I even on a blood thinner? The main purpose of being on a blood thinner is to prevent blood clots from happening. Now, I know we often refer to these drugs as blood thinners, but they don't necessarily thin your blood. What they actually do is decrease how much new natural clotting factors in your body are made. So they won't get rid of an existing clot, but prevent new ones from happening while your body takes care of the existing one. There are four main conditions that require the use of blood thinners. This includes a deep vein thrombosis, which is just a fancy way of saying a blood clot in your legs. They may also be used for a pulmonary embolism or a blood clot in your lung. Another condition called atrial fibrillation, where your heart isn't beating correctly. And if you're immobile for extended periods of time, such as a hospitalization. In people who have atrial fibrillation, they sometimes may be at an increased risk of forming a clot, so not all patients with this condition will be on a blood thinner. Since the heart is beating in an irregular manner, this makes it prone to blood pooling. This means the blood stays still. When the blood stays still, it can form a clot, and this clot can potentially break off and travel to your brain, causing a stroke. So if your doctor believes you are at risk, they will prescribe you a blood thinner. Sitting or not moving for extended periods of time can also put you at risk of forming a blood clot, specifically in the legs. That's because when you sit for long periods, blood can pool at the bottom of your leg, again giving rise to an increased risk of clot formation. And if this leg clot breaks off and travels to your lung, it can cause something called a pulmonary embolism, which is not a fun experience. It is also important to understand that certain drugs, such as estrogen-containing birth control, can also increase your risk of clotting, but just because you're on birth control doesn't mean you'll get a blood thinner. Just make sure to be active and look out for signs of clotting. The symptoms of a blood clot can also help your doctor narrow down the possible location of the clot itself. Now, I want to stress, if you ever experience any of the symptoms we are going to discuss, please seek immediate medical attention. The first common symptom I see a lot includes swelling of either the arms or legs. More often than not, though, it will be one single leg that is swelled, and the swelling will also sometimes be accompanied with redness or warmth. If you notice any swelling, it is very possible you have a clot in your leg, so again, go to the emergency room immediately. Chest pain and shortness of breath could be an indicator of a blood clot in your lungs. And if you notice any facial drooping, confusion, or difficulty speaking or understanding speech, that may indicate you have a stroke. Eliquis and Xarelto both work to stop something called factor Xa. This is a natural thing found in your body that promotes clotting. Coumadin works in a different manner, which becomes very important when we discuss counseling on blood thinners. Coumadin works by inhibiting a protein in your body that recycles vitamin K. That's because vitamin K is actually required to form blood clots. Blood thinners do come with some side effects, and some of them do warrant a visit to your doctor. Easily bleeding is a definite, as you may expect. If you do ever cut yourself, apply pressure to the area for a few minutes to allow the body to stop it. If you notice the bleeding won't stop, let your doctor know right away. Same goes for nosebleeds. A lot of people will get the occasional nosebleed when on a blood thinner. But if you notice they are happening very often or won't stop, again, please let your doctor know. When on blood thinners, you will also notice you bruise a lot easier, so a little bump may cause an ugly mark. It's unfortunate, but it may occur. Now, the next few symptoms I'm going to mention may sound scary, but you need to be aware of them and need to know they require an emergency room visit. They include any change in the color when using the bathroom. Whether it's number 1 or number 2 and you see black, pink, or red, that may indicate an internal bleed. If you notice you are coughing up blood, have a severe stomach ache, or a headache that just won't go away, it could also be a sign that there is a bleed happening inside of you. When it comes to how to take this medication, it is important to take it every day. Missing even one day of your blood thinner could put you at an increased risk of forming a clot, so always make sure you have enough if traveling as well. One important thing to note is that if you are taking Xarelto, it needs to be taken with food. Taking it without food will decrease its effects and how protective it is. Let's switch gears now and talk about some important things you need to know about. If you ever hit your head or fall, you need to go to the emergency room right away. Even if you feel fine, as many do, you don't really know what's going on, and imaging may need to be done just to make sure nothing in you is bleeding. I always tell my patients to use a soft bristle toothbrush rather than the electric ones. This isn't something you must do, but it can minimize gum bleeding. If you shave at all, I also suggest using an electric razor over a blade just to prevent any accidental cuts. And I highly suggest anyone who is on a blood thinner get a Med Alert bracelet. These can be purchased at any pharmacy, and just let any emergency responders know you are on a blood thinner. And please make sure to let all your doctors, pharmacists, and dentists know you are on a blood thinner just so they are aware. Now remember how we mentioned that Coumadin works on vitamin K? Well, when on Coumadin, there are a few extra things you need to know. The major thing is to make sure your diet is consistent, especially when it comes to greeny foods such as kale or spinach. A lot of patients think this means they can't eat anything green, but this isn't true. The main thing is consistency. So if you eat 3 salads a week, just continue with that. And if you make any changes to your diet, let your doctor know so they can adjust your dose accordingly. Other things you want to completely avoid include grapefruit, green tea, and cranberry juice. This is because all of these drinks can affect the way Coumadin works, and that's something we don't want happening. Another thing about Coumadin, which isn't necessary with the other blood thinners, includes frequent blood work. In the beginning, you may have blood work done multiple times a week, and that's because your doctor needs to make sure you are not at risk of bleeding or forming a blood clot. This means your dose may change frequently. If this ever occurs and you need to get rid of your old dose, there are some precautions we need to practice. For one, we don't want to just throw these drugs in the trash. The trash can be accessed by animals, and the last thing we want to do is cause them to bleed out. So if you ever need to toss out your Coumadin, just put it in a plastic bag and fill the bag with either coffee grounds, dirt, or kitty litter. This makes it harder for any animals to get into it. The last thing I wanted to mention was that you should avoid alcohol and never take any non-steroidal anti-inflammatory drugs such as Advil, Aleve, or Motrin. All of these can increase your risk of stomach bleed, and let me tell you, it is not a fun thing. You should also avoid aspirin unless directed by your doctor to take it. Thank you so much for watching. If you found this helpful, please consider liking and subscribing.